implants are devices or tissues that are placed inside or on the surface of the body. Natural polymers are now used in many medical applications.
What makes these biomaterials so special is the fact that they are accepted by the body. This acceptance between the material and the body is crucial to avoid complications, and this is especially important with the advanced biomaterials scientists are developing now, materials that are made to become permanently integrated with body tissues. Here at the Department of Biomaterials, scientists behind me are working to find solutions for situations like this.
When you place a material inside the body, then their proteins will adsorb to the surface. And then there will be cells from the bloodstream that will come to the surface. And after that, inflammatory cells. And they will sense if this material is toxic or if it could work in the tissue. And this is biocompatibility, that the material and the biological system works together.
This biocompatibility is much dependent on the surface chemistry of the material, and a lot of research is done to understand this better. So in this little glass beaker here, we have little discs of titanium and a solution containing bacteria. And what they want to do here is to see how bacteria settles on different coatings of the titanium. Altering the surface chemistry by applying different coatings to the titanium, they aim to minimize the risk of infections. And when looking at the type of implants they are developing here, it's not hard to understand.
Polymer is a chemical compound that is made of small molecules that are arranged in a simple repeating structure to form a larger molecule. Biopolymers are used to replace diseased or damaged parts such as hip joints, teeth, heart valves, and blood vessels. Some implants are made from skin, bone, or other body tissues, while others are made from metal, plastic, ceramic, and other materials that are inserted inside the body.
Polymer can be placed permanently or they can be removed once they are no longer needed.
For example, hip implants are intended to be permanent, but chemotherapy screws to repair broken bones.
Soft tissue retractors are now placed about the acetabulum to facilitate acetabular exposure in preparation for acetabular reaming. In this step, an acetabular reamer is brought into the acetabular socket, and the remaining of the diseased osteoarthritic cartilage is removed prior to pressing in place the acetabular component which grows solidly into the bone. A plastic bearing shell is snapped inside the acetabulum. The hip is then exposed by flexing the table and placing soft tissue retractors about the proximal portion of the femur, facilitating exposure of the proximal portion of the femur in preparation for femoral broaching. The soft tissues at the superior corner of the exposed femoral neck are released, and a rongeur is used to remove any remaining residual neck. A series of cutting broaches are then impacted down the length of the femoral canal, preparing the femoral canal for final implant insertion. Once the final broach is in place, trowel components are assembled on top of the femoral broach, and the hip is put back in the socket, a process that we call reduction, in order to trial the fit of the components. At this stage of the operation, when using the direct anterior minimally invasive approach, it is also possible to examine the hip under fluoroscopy to make sure that the limb lengths are appropriately reconstructed and that the fit of the components within the anatomic landmarks of the acetabulum and the femur is appropriate. At this stage of the operation, we check to make sure that the final fit and fill of all the components is appropriate, the trowel components are exchanged for the final implants, and the hip is reduced and the incision closed up.
There are risks of having medical implants, such as surgical risk during placement or removal.
In cases like medicines, polymers are used to cover powdered medicines to easily reach the different parts of the body since it is easily dissolved once you take it.